This is Dr. Eileen Shake, and I am faculty in the CUNY School of Professional Studies in the nursing program. I would like to welcome all of you to the webinar tonight. This is an exciting time for nurses, and we're going to share information with you about the Master's in Nursing program at CUNY. So let's get started. I would also like to say that if you have a question, please type it in the chat box, and I will try to answer questions that I can answer at the end of the webinar. And then we will also provide you with an email address that you can send your questions to if you don't get them answered tonight. So at CUNY, we have 3 different tracks in our Master's in Nursing program. We have an MS in Nursing Education, and a track in the Mathematics, and an MS in Nursing Organizational Leadership. All 3 also offer an advanced certificate option. So you might be asking, why earn a master's degree? I'm sure if you're listening to this webinar tonight, you already have a good idea of why you need to pursue a master's degree. It definitely enhances your job opportunities, and it can help you advance your career. It also puts you one step closer to pursuing your doctorate degree. Perhaps you want to get a PhD in nursing, and you want to work in nursing research or teaching. And it offers you the opportunity to pursue positions at the highest levels in leadership and healthcare administration. Let's discuss some of the factors behind the increased emphasis on RNs earning their BS. I'm sure many of you are familiar with the Future of Nursing report. In 2010, the Institute of Medicine and the Robert Wood Johnson Foundation partnered to examine the changing that was occurring in the healthcare industry. The National Academy of Medicine gave direction related to the delivery of healthcare, and they all worked together, the Institute of Medicine and the Robert Wood Johnson Foundation, and produced a report called the Future of Nursing report. In this report, there were key recommendations for nurses, and some of those recommendations are on this slide. One of the important recommendations: nurses should be able to practice to the full extent of their educational training. Nurses should seek higher levels of education. They should be full partners in redesigning healthcare in the United States. And they should participate in implementing infrastructures and data collection for workforce planning and policy making. On this slide, we're going to discuss magnet status. A number of healthcare organizations around the country today are seeking magnet status. Magnet status is the good housekeeping seal of quality care and excellence in the delivery of healthcare. Magnet status emphasizes advancing the education of nurses as an approach to improving care, recognizing that nurses are on the front lines of interactions with patients, and advocating that education can help nurses develop skills to translate their ideas into best practice that impacts the delivery of patient care. The ANCC Magnet Recognition Program educational standards include that the nurse, 100% of the nurse leaders working in the organization must have a BSN or MSN, and that 100% of the nurse managers working in the organization must have a BSN and or MSN. And there is a new standard. 80% of registered nurses should be working to obtain a degree in nursing, that is a BS or MS, by the year 2020, which we are now currently in. The implementation of the Affordable Care Act, also known as Obamacare, added millions of insured people to the healthcare system, but fundamentally changed how healthcare is delivered. The 2 million RNs in the country are in the best position to integrate this level of care as the members of an interprofessional care team with direct access to patients, families, and communities. Enhancing the education level of nurses will build the knowledge and skills needed to contribute to this collaborative effort to provide patient-centered care. There is a greater emphasis on health coaching for health promotion and disease prevention, and reimbursement changes are moving away from fee-for-service and episodic care encounters to address management of a person's health through its ups and downs and value-based purchasing. Nurses will be key players in this model. Therefore, there are new roles developing for nurses. Because of the changes in reimbursement, there are going to be new roles for RNs. There are going to be leadership opportunities in projects and many other areas, case management positions, health coaching for promotion and prevention positions, increased use of technology for care management, which is where a master's in nursing informatics will really help position you as a nurse leader to participate in new technology development, and interprofessional care. So why choose CUNY to pursue your master's degree? So if you're thinking about going back to school, let's discuss what should you look for when you decide to enroll. First of all, what does the program offer? What's the cost? How much time is it going to take? What's the location of the program? Will you have to travel to the site to take classes? Your learning style. Traditional face-to-face, does that work better for you? Or online, synchronous versus asynchronous learning? What are the on-site requirements in the program? And what about clinical placement assistance as you complete your projects in your practicum project and your clinical hours? And it's important to note that our nursing program at SPS have fall and spring admissions. And when you're thinking about cost, is the tuition affordable? Will the school allow you to transfer in credits? And time is such an important factor, very valuable to you because you're all busy working and you have other commitments. So you need to ask the question, do I need to work or can I commit to just going straight to school? How long will it take to complete the program? What time are the courses offered? When are courses offered? And really think about your learning style. Do you prefer a traditional classroom lecture setting? Or would you prefer to work online at your pace and when you have time to complete the assignments? What will work best for you? It's important for you to remember all MS programs registered are required to have students complete clinical requirements in the specialization area that you're pursuing. So if you're pursuing a master's in informatics, you'll need clinical hours in that specialty area. And you need to ask yourself, does the program offer assistance with clinical placements, finding preceptors, providing support with clinical instructors? Or do students have to navigate this on their own? There is a focus on embracing diversity in healthcare. We believe in an interprofessional model of practice in today's healthcare arena. This model fosters development of leadership and collaboration skills and is an effective approach to apply evidence to practice. So let's take a look on this slide at nursing at CUNY SPS outcomes. Communicate effectively with diverse groups to address disparities and ensure equity in health outcomes. Apply leadership strategies and provision of safe, quality care. Engage in interprofessional care collaboration. Design health policies to address local, global population health concerns. Optimize emerging technologies to support safe practice environments. Implement care management across disciplines inclusive of prevention strategies. Analyze research and implement evidence-based care. Examine organizational and financial structures of healthcare delivery systems for their impact on patient outcomes, and integrate nursing and related sciences in design, delivery, and evaluation of healthcare outcomes. Part of the City University of New York CUNY online campus is located at 119 West 31st Street in New York City. CUNY School of Professional Studies is the actual school that the School of Nursing is located under. We have an on-site campus, but our program is totally online. The program is regionally accredited by the Middle States Commission on Higher Education. It's accredited by the New York State Education Department Office of the Professions. And CCNE site visit was completed September 23rd through the 25th of 2019 for our accreditation visit. And our undergraduate nursing program is already accredited by CCNE, which is the Collegiate Commission on Nursing Education. And I'm sure most of you on the line are aware of that. So who are our students? They're working adults, many in career transition, people with families of their own, students who need a degree that fits their schedule. Does that sound like you would fit into some of these areas? So what about student services offered at CUNY SPS? We have the Baruch Newman Library, which is online and on campus, plus all CUNY libraries are accessible to our students. We have a help desk with tech support for you. We offer tutoring online and on campus. We have career services to help you, and we also have mental health counseling. At SPS, nursing students have some unique learning opportunities. In our AP Health Assessment course, we want to build on the skills that you already have. So there are opportunities to work with digital virtual patients, as students also have opportunities to participate in leadership opportunities, such as Sigma Theta Tau Honor Society. And local professional development activities are available, such as our Nurse Leader Speaker Series. And on this slide, you see some examples of what we offer. We have a program that students work with called Shadow Health, and they complete some of their clinical experiences in shadow health by practicing. We have virtual patients in shadow health. We have professional development workshops. We offer unique learning experiences and leadership opportunities. So what is it like to learn online? Well, for you as a student, if you want to get a better idea of what an online class is like, go to the SPS website and follow the link to online learning for an example. Now, expect to spend 8 to 10 hours a week if you're taking one of our courses, working on the course. Remember, time management and self-motivation are key to being successful in online learning. We have small classes with 15 to 20 max in the classes. This is really a great way to get to know your fellow students and the professor, and you have a lot of one-on-one opportunities to interact with your fellow students and the professor if you need the professor's help. Online courses will feel very familiar to what you've experienced in your college coursework so far. Just picture this in your head. You walk in on the first day of class and you introduce yourself to your professor and classmates. You'll review the syllabus from the professor and understand what you need to do for a good grade. You'll have lectures, homework, readings, and discussions. You'll ask questions and start new discussions. You'll have quizzes, midterms, papers, and exams. Sounds like a traditional in-person class, doesn't it? But the big difference between an online course and one in-person course is in how you communicate. It does require that you have a computer. You must have one to be successful. In our program, it's asynchronous learning, and I have shared with you the sizes of the classes, 15 to 20 max. It's engaging. Expect to work 10 to 12 hours a week on the coursework, and you must have computer and internet access. And here's a website on this slide if you would like to view an example of what online learning is like. And I'd like to pause just a minute and also say that this webinar is being recorded. So you will receive an email with the link to the recording if you want to go back and review the webinar, something I said that you might have missed. So now let's talk a little bit about online readiness. Some questions from SPS Online Readiness Quiz are listed on this slide. And you might want to take just a few minutes to ask yourself, do I have access to a computer with high-speed internet connection? Am I comfortable installing and troubleshooting software on my computer? Am I proficient in using search engines and advanced search options? And do I have 8 to 10 hours per week to dedicate to each of my courses? These are all very important questions that you need to answer yes to in order to be successful in online learning. Let's talk a little bit about time management tips. When you're learning online, you need to prioritize your activities. Once again, on this slide, we have the hours you need to expect to participate in the coursework each week. Make time for reading, researching, responding. Have a calendar planner and put your learning activities on that. There's some tech tips on this slide. Make sure you understand your computer requirements, that you have Wi-Fi. We have Blackboard Mobile and tech support. And we also have a link on this slide for time management tips. So, what does online course look like? Well, here's a picture of what you would see on the announcement page. On the left, you have a menu bar, and that's where you click on the different menu options that take you to different parts within the course. So we have an announcement section where your professor posts announcements. Then the instructor information, contact information, and a little bit about your instructor so you know how to contact them if you need them. Course information has an abundance of information for the course. Your weekly materials, there's 15 weeks in the semester. So when you click on weekly materials, you'll see all 15 weeks, and then there'll be links that you'll click on, and you'll go inside that weekly material section to view your assignments for the week and the information you need to read, or PowerPoint presentations or videos. Whatever your learning activities are for the week will be under that weekly assignment link. Then you have Assignments tab. This is where all your grading rubrics and assignment guidelines and your assignments will be. And then you have Discussion board. You have discussion board assignments, and you go there. And then you just see so forth and so on. We have Shadow Health, your e-portfolio. You can check your grades, send emails, the Newman Library. So there's an abundance of information that you can access the entire course through this menu tab. So what does an online course look like? Here again, this is week 1 and week 2, and this shows you what I described on the previous slide, and this is what it looks like, of where the learning activities are located and your assignments for that week. So what about tuition and fees? In 2019-2020 tuition fees, you can visit this website to read about the tuition cost for graduate school. To give you a quick overview, if you're part-time, it's $470 per credit hour. It's $5,545 per semester if you're full-time. In-state rates apply to all students enrolled online in degree programs, and financial aid is available. Programs qualify for federal, state, and private programs. You can speak with a counselor about your specific situation to see what type of grants or other types of funding, scholarship money that might be available that you can apply for to help with your financial needs. The MS in Nursing program requires that you complete 45 credits for degree options. Whether you choose the MS in Nursing Education, the MS in Nursing Informatics, or the MS in Nursing Organizational Leadership. Here we also have a web link for you that you can visit to get additional information on this. The advanced certificate is 18 credits, and your options are you could get an advanced certificate in nursing education, in nursing informatics, and nursing organizational leadership. All advanced certificates are postmasters, and there are application deadlines, and you can visit this website to see those deadlines. So once again, the MS and advanced certificates in nursing for the MS, 45 credits. And on this slide, these are broken down. You have 9 core courses, which equal 27 credits. These 9 core courses are required in all 3 tracks in the master's program. Then you have 4 specialty courses in your selected track, which are equivalent to 15 credits. This includes a 135-hour practicum, which are clinical hours, and then a graduate elective, which is 3 credits. In the advanced certificates program, you get 18 credits postmasters, 4 specialty courses in selected track that you choose, and this includes a 135-hour practicum and graduate elective, which is 3 credits. On this slide, you will see an overview of those core courses that I just talked about. In Nursing 600, you will explore nursing and public policy formation in relation to healthcare systems organizations as well as healthcare policies that frame healthcare financing, practice regulation, access to care, safety, and quality. In Nursing 601, you explore nursing science, theory development, and role development in nursing. In Nursing 602, you explore basic financial and accounting concepts relating to healthcare management. Additionally, compliance with regulatory standards and third-party reimbursement issues and the impact of the SCOTUS decision and the Affordable Care Act. In Nursing 611, it builds upon basic health assessment skills, research on human development, anticipatory guidance, prevention, and early detection of risk factors and diseases are emphasized, and an overview of population care management is discussed. In Nursing 612, it's an in-depth case analysis of risk factors. Pathophysiological changes and associated clusters of signs and symptoms will be explored. Nursing 613, you will focus on applying pharmacotherapeutics to the management of health and illness in populations at risk for morbidity and mortality. There's an emphasis on synthesis of pharmacokinetics and pharmacodynamics principles for the prevention and treatment of acute and chronic illnesses. And, of course, evidence-based outcomes, consensus guidelines, and research studies are critiqued. And you will find that you will be doing the evidence-based outcomes, consensus guidelines, and research study critiques in many of the courses you take because evidence-based practice is threaded throughout all the courses. Once again, I would like to say that all of these courses are required in all 3 tracks. They are the core courses. In Nursing 615, you explore current trends and issues in nursing, designing and managing data within healthcare systems and/or academic settings. There is an emphasis on the use of information systems and technology to evaluate programs of care, outcomes of care, and care systems to inform quality improvement. And in Nursing 625, it prepares you as a graduate student in nursing to interpret and evaluate advanced statistical analysis, commonly used in nursing research studies. And last but not least in the core course, Nursing 626. This is the conduct of nursing research with an emphasis on the connection to evidence-based practice, quality improvement, and the use of aggregate data. Students will be engaged in evaluating the pros and cons of the different research approaches and in exploring various data collection methods. On this slide, you see the specialty courses in each of the tracks. So if you're pursuing a master's in nursing and education, these are the additional specialty courses that you will take. And you can see this. I won't take time to read over all of these, but as I said, this is being recorded and you can go back and look at it, this presentation. You will notice, and I will mention this, that every one of these tracks have a practicum, and that's a 6-credit-hour course because this is where you will complete your clinical hours. And you will be working on a project. So on this slide, it's a review of some of the things that we've discussed, and then there's some new information. for both the MS and advanced certificate practicums. The practicums are required for all tracks. Practicum hours equal 135 hours. And the options include, when you're seeking a site to complete your practicum hours as a master's student, you can do self-placement, and it's highly encouraged. You can find an organization and a preceptor, a leader who will work with you as your preceptor, and or CUNY SPS Nursing will help you with placement. If you do want help from CUNY SPS Nursing, then you will need to adhere to the requirements if they find you a site. And it's also important to say, and you'll hear this many times, you need to make sure that your organization has some type of agreement signed with CUNY for you to complete your project there. And you can check with Dr. Marge Riley to see if the organization, if we already have a contract with them, and if not, then you would need to get one. So let's take a few minutes just to look briefly at the MS in Nursing Education. On this slide, you see some information that you would be learning and exploring. In this track of nursing, you would develop curricula focused on changing healthcare systems. You would adapt education strategies for diverse learners. You would learn to develop and implement evaluation measurement strategies. You would lead and manage accreditation processes focused on national and state standards. You will learn how to do this. You will learn how to prepare students, graduates of nursing programs, and nursing staff to function in expected RN roles. You will be participating in testing and measurement, and once again in accreditation and preparation of future RN workforce. And then you'll be qualified to serve as educators in colleges, major universities, academic health centers, and community-based health facilities. Also, you'll be able to pursue a doctoral education. Potentially, you'll be able to sit for certified nurse educator exams. The MS in Nursing Organizational Leadership. You'll have the opportunity in this track, if you choose this, to develop and explore leadership skills and strategies to promote quality patient outcomes. You'll have an opportunity to advocate and mentor the professional nurse as a member and leader of an interprofessional team. You'll have the opportunity to design a nursing organization business plan utilizing budgeting, cost-benefit analysis, and marketing principles. In this track, you develop your leadership skills, you fine-tune them, you learn about interprofessional collaboration, you learn about finances and systems analysis, you also learn about policy analysis, you learn how to analyze how policies impact the structure and financing of healthcare, nursing organizations, and health outcomes. Graduates qualified and graduates from this nursing track are qualified to serve as directors of nursing, chief nursing officers, nurse managers, accountable care coordinators, and wellness program directors, as well as many other types of leadership roles. Now, the MS in Nursing Informatics, you will analyze institutional data needs. You'll utilize technology to design and implement plans to manage patient data effectively. You'll learn how to manage data efficiently to enhance quality and safety in care delivery. And on this slide, it's just a brief overview, and it tells you that graduates of this program are qualified to serve as clinical informatics specialists, informatics nurse specialists, clinical applications coordinators, and potentially eligible to sit for the ANCC Informatics Nursing Certification Exam. This track provides you an opportunity to extensively explore technology, organization, and design and data management to enhance quality and safety in care delivery, as well as analysis of data and application of data. So what is the admission criteria? You have to have a BS in nursing. You need to have a GPA of 3.0 or better. You have to have an unencumbered RN license and registration. You need to complete an admission essay. You need 2 letters of recommendation from nurse faculty or nurse educator and from a nurse supervisor or manager. You also need to provide a description of your role in an evidence-based practice project that you participated in. And you need to submit your updated resume. So you may be asking yourself, okay, what is an evidence-based project? I'm sure several of you have probably already participated in one, but if you haven't, an evidence-based project, there are several examples, and they're listed on this slide. Perhaps you've completed a capstone project in one of your previous nursing programs during your nursing educational journey. Perhaps you participated in a quality improvement initiative at your facility. Examples include implementation of an updated fall prevention policy, pain management policy, or restraint policy. You need to talk about how and write about how did you participate in implementing the evidence-based project. What was your role? You can describe the rationale, which is the evidence, to support the use of these policies. And these projects can have occurred in your current organization you're working in, if you participated there, or in any other organizations that you've worked in the past. It can be acute care and long-term care facilities as well. So what is the application process at CUNY? Here's a website you can go to and learn more about the application process. And you will apply for one of these specific programs listed on the slide. These are our 3 tracks that we offer. And you'll click on the Apply Now Application tab, use your CUNY First account, or register to create a new account if you're not a CUNY student or graduate. You select the program and you will see everything that you need in order to apply. Now, the application process for advanced certificates, here's the website you would go to, www.sps.cuny.edu, and you'll go to Academic Certificate Programs. And here are the 3 certificates, advanced certificates that are offered. Once again, you'll click on the Apply Now Application tab, use your CUNY First account, or register to create a new account if not a CUNY student or graduate. If you have been a CUNY student, to apply online, you must log in using your CUNY First account. You're familiar with that. If you're not from a CUNY school, you can create an account. And here is the website, this is an example of what you will see on that page when you go there and start your application process. So welcome to the online application for graduate degree and undergraduate and advanced graduate certificate programs at CUNY School of Professional Studies. When creating your account, please be sure to use an active email address that you check on a regular basis. If you have previously submitted an application through our online application system, please create an account with a different username than the username that is associated with your previous application. And this is an example of what you will see in the information that will direct you to what you need to submit. Now, what about scholarships? You're probably asking, does CUNY offer any scholarships? We have a grant from the New York State DOH Health Worker Retraining Initiative. It's funded through the John F. Kennedy Jr. Institute for Worker Education for the 2019 and 2020 academic year. Award amounts: tuition for one graduate course and some professional development activities are available. The eligibility criteria for this scholarship: acceptance into the MS in Nursing program at CUNY School of Professional Studies, prior or current employment in the healthcare industry, New York State resident. You must be a New York State resident. Registration, in other words, you have registered for at least 6 credits each funded semester, and successful academic progression. You need to have a B or better, which is required in all the nursing classes. You must have a B or better in order to pass them successfully in the master's program. So, will you be prepared? That's the big question. Shift happens. And we have seen tremendous change in the healthcare industry. I'm sure some of you remember when we had big rooms with files, as you see a picture here of a nurse, all paper filing patient records. Now they're all online. Then we had these huge desktops. You see a picture of that. Now we've moved to tablets. So you need to be prepared. We have a wonderful report from the Institute of Medicine, The Future of Nursing, and it tells us why we need to be prepared, and that shift is happening, and we're seeing tremendous changes in the healthcare industry. It's very important that you seek a higher degree in nursing so that you can expand your knowledge to pursue the roles and that are going to be expected for you to fill and participate in the future. And it also empowers you as a nurse to have numerous career opportunities, expand your knowledge, and to become the nurse leaders that you're passionate about being. So, CUNY SPS Nursing. For more information, visit our website at sps.cuny.edu/nursing. You can call the phone number 212-652-CUNY if you have specific questions you can't find answers to on the website. You can write an email to nursing@sps.cuny.edu, and you can also view us on our Facebook page at www.facebook.com/CUNY SPS Nursing. I would like to say Dr. Marge Riley is the academic director of our program, and she would very much love to have you enroll in our program, and we welcome and get excited about helping our future nurse leaders learn and hearing about their new ideas. So please take time to consider attending our nursing program if you're interested in one of the 3 master's tracks that we offer, and connect with us on Facebook. At this time, I would like to say that if you have any questions, please email them to nursing@sps.cuny.edu. And once again, as I said earlier in the presentation, you will be receiving an email with the link to this recorded webinar and all the information. I'm going to quickly take time to see if there were any questions posted in the chat box that I could answer for you. I don't see any questions posted. at this time. So once again, thank you so much for attending this webinar, and we hope you will decide to choose CUNY SPS and enroll in one of our nursing programs. Thank you very much, and I will end the webinar now.